guys, Taylor and Polly here from Beaten Jeans, and today we are talking to Ilana. I think that's how you say her name. She is, most importantly, she's had a gastrectomy. She's also a dietitian, and that's really all we know about her. So we're really excited to invite her in and talk to her, hear her story.
Hope you guys are having it.
Let's see.
So it's been a while since we did one of these.
I know. The last time we did it was with you.
That's right.
Hi!
Hi.
How are you?
Good. How are you?
Good. Now tell us how you pronounce your name.
It's Ilana.
Ilana.
Okay, we
that's
got
so
it right.
pretty. I like that.
Thank you.
Where are you coming to us from?
New York. I'm in Brooklyn. I'm at home right now.
Awesome.
Oh, wow.
Very cool.
What's the weather like in New York right now?
Hot, which is why I had the earbuds, but it's not working. So the AC's just going.
Oh. It's all sweaty in there or what?
A little bit. It's okay.
Well, thank you so much for coming and sharing your story with us. We always say that every single time someone does one of these, it helps numerous people. So thank you very much for speaking out.
Yeah.
Thank you for having me, and I'm really excited because same thing. My surgery was about a year ago, and I've never met anyone in person, and so it's just really nice to sort of step into this community and see that there's other people, especially like younger people out there going through this, because it's, you know, I have a very supportive community and family, but no one can really relate to it. So it's really nice to have this.
Absolutely.
Wow. Yeah. So how old are you?
Actually, my birthday's next week. I'm turning 32.
Well, happy early birthday.
Thank you.
So tell us about how you came to have your stomach removed. Do you have a genetic mutation, or was this something different?
So this was a genetic mutation. It is CDH1, and I'll get into this, but it's a variant of unclear significance. And so initially I was told not to remove my stomach and get screened. And then last summer during my sort of yearly recommended screening, they found signet ring cells. And all of a sudden it was like, okay, guess that gene means something. We're doing this now. So, it all moved pretty quickly after that.
So what made you decide to test for the CDH1?
So in 2017, my mom was diagnosed with stage 4 stomach cancer. And her mother had actually had stage 4 stomach cancer. Yeah, so it was in the family. But when my grandmother was diagnosed, it was the late 90s, and I don't think CDH1 and these conversations about extensive genetic testing were even being had. And she was also in her late 60s, and she was a heavy smoker. So I think it was kind of just assumed that it was like lifestyle, environmental stuff. And so my mom was given the advice to just get screened every 5 years. And she wanted to trust, and I think there was very little information, so that's what she did. And between her 5-year screens, she went from nothing to, they found stage 4. She had no symptoms. And I think part of that is why this CDH1 gene is really scary, because it's that diffuse. They didn't see anything. She felt fine. She actually had to lie to get her 5-year scan. And they asked her if she had blood in her stool. And she was like, yeah, I do.
Oh,
and then
really? They weren't just going to do it for her?
Wow.
They were trying to talk her out of it. They're like, you're in your 50s. You're young. Do we really need to do this? And then it turned out like, yes, we definitely do.
So they didn't even know your mom had the CDH1 at that point. Okay.
No. So she was diagnosed about 5 years ago. And then after that, between my mom being, you know, she was in her 50s when she was diagnosed, and her mother, obviously then that threw up red flags. And so she got tested and hit with a unclear variant of CDH1. Our family got tested, and I, you know, won the lottery. I'm the only one with the gene. But at the time, they didn't totally know what it meant. Yeah.
When you say your family, like, do you have siblings or anything? Or, okay. How many siblings do you
Well, so I have an older brother, but he's my half brother, same dad, different mom.
Okay.
I have a younger brother who's my full brother. He got tested and he was negative. And then my mom had a sister, and then she has kids and grandkids. And so my mom's sister tested negative. So the rest of the family, was able to rest easy.
Oh my gosh, you really were in this alone, basically.
A little bit. Yeah.
Yeah. You had your mom.
I had my mom, which was, was conflicting because as irrational as it was, she felt really guilty. She was like, I gave this to you. And I'm like, how could you have possibly known? She was.
How is your mom doing?
So unfortunately, my mom passed away in early 2020. They just caught it too late. As you guys probably have looked into it, by the time it's stage 4, there's really not a ton that can be done. But one of the things that was really important to her and to me was that I be very on top of it, that I be proactive. Because the gene was kind of an unclear variant, I got a lot of conflicting advice. I got advice to get screened every 3 years, which would be, an upper endoscopy, and then they take biopsies inside the stomach. And I was told by another doctor at the same facility to do every 3 to 6 months. And I was like, we're gonna do the conservative one. And it kind of landed where I was getting screened once a year.
Okay.
And where were you being screened?
Memorial Sloan Kettering. That's where my mom was, and I really did. She got amazing care, and I trusted the doctors, and they knew about CDH1 in a way that I don't think if you go to a local gastroenterologist, they haven't all even heard of this gene because it's not that common. And so I wanted to stay where they were, knew about my mom and were going to take me seriously. I did not want to be in a situation where they were like, you can skip your screen this year. Like,
yeah, absolutely.
We're not doing that.
Yes, I've heard wonderful things about Sloan Kettering.
It's fantastic. I've seen other people in the community, posting about, I was through Sloan. My doctor was Dr. Strong. She was incredible. The whole team was amazing. So my yearly screen, they hit on very small cancer cells. So I was stage 1A, and they just said, it's surgery time. So between getting the diagnosis and surgery was about 6 weeks. So it all
not
kind
a
of
whole lot
moved.
of time to get prepared and process.
Because I know from what I've seen, you guys have had sort of years to sort of plan and think about it and research. And I did I kind of just had a feeling that I was going to need to have this surgery at some point, obviously hoping that I wouldn't. So it didn't come as a total surprise, but I did think I would be older. I was diagnosed at age 30. So obviously that's always jarring.
Right.
Well,
with your family history, a strong family history. Yeah. So when you say it's with low significance, is that VUS, the variance of unknown significance? So now I would think that they could say that it's significant, right?
Yeah.
That's sort of the next process we're going through. We shelved sort of focusing on that, obviously, because I needed to get through surgery, but I am working with their genetics team and sending as much of my records, and they're doing more testing. And the goal eventually is to see if we can get this gene upgraded from a VUS to probable pathogenic gene, so that other families who have this get clear information, because I can't blame my doctors for sort of not having an answer for me, but it was hard. It was hard to not really know how worried I should be about this.
Right. Yeah, I know a lot of people who have the VUS are just so uncomfortable with that diagnosis. They don't know what they should do, how other screening should be, or just tuck it under the rug for later.
Yeah.
So it would be great for you to be able to update that for people who may also have that same variant.
Definitely. So I think it's a years-long process, but we've got it started. So hopefully the ball kind of gets rolling with that.
Good. Yeah. Good. So tell us about your surgery and how it went.
Yeah. So I had my surgery actually this past Tuesday was a year. So it was August 30th of 21.
Well, congratulations.
Thank you.
It's a long way.
Completed. Yeah. Yeah, it's been a pretty wild year.
Right? And then you kind of start feeling normal again. So was that the case, or?
By now, yes. The last few months have been way easier. And I'm also very lucky that I'm glad I did this young. I also had actually just finished a yoga teacher training right when I was diagnosed. So I was like the fittest I've been and felt like very energetic. And then I had that 6 weeks. I ate whatever I wanted. I put on 10 pounds. I was like ready to go.
How was your surgery?
So initially my surgery was fine. I was in and out of the hospital in about 5 days. I had several early complications. So really the first 3 to 4 months after my surgery was pretty rough and I did not feel well. And then after that, I had a pretty rapid trajectory upwards once things kind of got solved. I had an epidural put in for the surgery for pain control and we think a leak and I had crazy headaches. And so I got dehydrated and all of that. And then about 3 weeks out from surgery, I did end up with an intra-abdominal infection. And so I was back in the hospital for about 2 weeks. So that
was that from the leak?
Well, the leak from the epidural?
This was separate. They think probably what happened is really over the course of a couple of days, I wasn't eating well. I hadn't really gone to the bathroom. I got really backed up and they think I probably had some tiny perforation. And so kind of around my small bowel and inside my belly, I got an infection. And so, IV antibiotics, I got some drains put in. Luckily, they were saying that if that didn't work, the next resort was going to be going back in for surgery. And I was like, please don't let that happen. And luckily, we worked around it.
Wow, so you were hospitalized with that.
Yeah.
2 weeks, that's a long time.
That is a long time. How scary. And you worry about sepsis when you have an infection like that with your bowels.
Yeah, I was septic initially when I got there and they had me. Yeah. Luckily they had me in step down. I never had to go to the ICU. I was never out. I just felt miserable. And I obviously couldn't eat. So that first 6 to 8 weeks after surgery, I lost a bunch of weight sort of more quickly than I was expecting. And then I was feeling better after the infection. And then I got an esophageal stricture, which is, when they put the esophagus with the jejunum, I was noticing that swallowing was sort of getting harder and harder. So I had to go in for a couple of dilations. So that took me out till about 4 months after surgery. And once the swallowing was sort of better, I was at my lowest weight. I was definitely feeling really exhausted. But then I was able to start eating and drinking normally. And everything just really turned around. So
good.
Yeah.
How many times did they have to dilate you?
Twice.
Two times.
Yeah. And I've heard of people having to get 5, 6, 7. The second time they made a tiny incision and they said it was going to help keep it open more permanently. And that was months ago and I haven't had any issues since then. So I think it's solved.
Okay. And do they say that this is something that you may have to have done again? Or do they think that it's once they've stretched it and dilated it to the comfortable place that you're good now forever?
Yeah, they told me I'm good. I think for most people, the way I had it explained, they did warn me even beforehand that some people in the first few months can get that stricture and that most people, once they do enough dilations, that usually it stays that way. And I haven't heard of too many people years out having to, deal with this.
Okay.
So.
Good.
Yeah.
So you're all good now, healed, and hopefully you're back into doing your yoga.
Yes. I'm back. I'm not teaching. Unfortunately, between doing the teacher training and getting diagnosed was such a short period that the teaching got dropped, but I do want to get back to it. But I'm back to practicing 3, 4, 5 days a week. I feel like I'm mostly back to where I was a year ago.
How are you with the inversions? Because I heard that's difficult without a stomach.
I need to really make sure I don't eat or drink too much before a class because sometimes you do that down dog and you fold over and whatever Gatorade I got going on goes whoop, like, oh, okay.
Right. Oh,
Down.
gosh.
It's hard, honestly. Some of it with the yoga is the mental practice of a lot of times I feel a little bit uncomfortable because I'm sure, Polly, you're dealing with this when you eat and drink, like you just really feel it in your body. I don't know, in a way that I didn't used to before. Like I will feel really sort of full and just heavy. And so some of the yoga is just being like, I'm not going to focus on that. I'm going to focus on something else. And it is something that you sort of live with chronically. And I think you kind of just get used to, you know, my body's going to feel a little bit different now.
Right.
Than it
It's
used
like
to.
that new normal, everybody always says, right?
Yeah. As much as I'm sick of hearing that phrase, it is very apt. I do feel like, you know, I'm at the new normal.
Yeah. So are you experiencing any bile, or is that just the Gatorade that comes up, or do you have that bile reflux?
I occasionally get bile reflux, really just when I make very bad food choices. Like I can't do French fries anymore. So usually if I eat something like really greasy fried, which I don't really do anymore, then like overnight I'll get some of that bile reflux. And it's so unpleasant that I've really been careful with the diet because I don't want to deal with it. But luckily it's at a point where it's manageable just through diet and I don't need to like medicate for it or anything.
Oh, that's good.
So
Yeah.
you are a nutritionalist,
Or
so
registered dietitian.
a dietitian.
Yeah.
So how did that help you like prepare, and do you feel like it's helped you in this journey?
It was definitely helpful, but I will say when I was diagnosed and I knew this surgery was happening, I've worked with people who have had this surgery before. I've been working at a hospital as a dietitian for about 9 years now. I've worked with like oncology. I've worked with people who have had like stomach and pancreatic resections. When it's yourself, a lot of it just flies out, and I was in a panic. But luckily, Sloan also has amazing dietitians, and they had one who called me before surgery, and then she checked in with me multiple times after surgery to really sort of walk me through it. And obviously, she didn't need to start from square one. Like, I already knew what dumping syndrome was. I already knew kind of the basic building blocks of what this diet is going to look like. But she really was able to give me a lot of ideas. And I also didn't realize how much the chewing was going to be a thing, especially in those first few months. They're like, oh, you got to chew really well. And I'm like, sure. Okay, whatever. And you really have to just sit there. I stayed with my dad after the surgery and we would eat together. And I'm sitting there and I'm still chewing. And they're like, are you for real? I'm like, yeah.
Yeah, it's almost hard to swallow at that point, isn't it? It's like,
yeah.
Just kind of gag it down.
Well, I do. It's like getting better now, but for a while I developed this involuntary thing where while I was eating and stuff, I'm like burping myself like a baby, and people would be like, what are you doing? And I'm like, I don't know. It just feels good after I eat. So yeah, it's a little odd, but.
So what were your biggest challenges as far as food goes in the beginning? I mean, probably after your surgery and you got over that hump, what were your biggest challenges?
Yeah. I mean, in the first 6 weeks, because I had that infection and stuff, I really was not eating a ton at all. And I think some of it was psychological. I think some of it was fear. Especially after those first few weeks when I would eat and I really wouldn't feel well, but I was like on a ton of antibiotics. I like all of that. It was kind of whatever I ate. So I did start to have some aversions where I just sort of would rather skip meals. And then I think really some of it was just the having to slow down, having to chew well. Like I love food and I also was a pretty fast eater. So I think really being conscious and sort of that mindful eating of like, I can't be on my phone. I can't be reading a book. I can't be mindlessly eating or mimicking the other people that I'm with. I really need to take one bite, put the fork down, chew well, wait, like pay attention to how I'm feeling. So all of that was kind of a tough adjustment for sure.
Forming new habits, right?
Hmm?
Forming new habits as far as
yes.
eating goes.
Yeah, and it takes a while, and it's, there's all of these new habits, and obviously for me, especially, so I did a short-term disability leave from work, and I'm single, I live alone. And so I went back to Long Island to live with my dad for 12 weeks after surgery, which was the time I took off work. So like everything changed with the food. I went from doing yoga all the time to having to be kind of completely sedentary initially. I didn't feel well, and I wasn't at home. I felt like a teenager because I was back with my dad, and he was following me around with a jug of water being like, have you drank today? So it just like my whole life felt like it got thrown up in the air. So I think it was just a lot to get used to at once. But obviously after that, like I moved back into my apartment, I went back to my job. And so some of just getting back to my normal life helped me feel more like a person.
Right.
Yeah. And are you able to drink water? Can you drink plain water?
Yes. It's not my favorite anymore. I don't even know how to describe it, but it feels weird, and I can't drink too fast because it doesn't hurt, but it's very uncomfortable. So I do a lot of, I'll do like Gatorade and I'll dilute it. I do like the liquid IV, and then I do seltzers, and I like sparkling water, and I put it in a cup and I get a spoon and I mix out the bubbles. Yeah. Which should be the same as water, but I think just the flavor and that makes it easier to swallow or something. I don't know if it's in my...
There's like a surface tension on water that makes it hard to drink.
Yeah. So I do a lot of that.
Oh, I don't have it. I can drink water. It's weird. Everybody's so different.
Yeah.
Now, have you had any, do you do your blood draws and your scans? Are you doing that like every 6 months, or are you doing it yearly, or what does that look like?
So they told me yearly scans for the next 5 years for, like chest, abdomen, pelvis, of like making sure. So I got a clean scan in April. And so then I'm going to keep going back. Okay. As far as the breast cancer risk, again, the conversation of the mastectomy came up, and they told me to hold off, which I have mixed feelings about. So I'm getting imaging every 6 months, alternating between a mammo and an MRI. So I do feel like I'm really on top of it. Maybe I do think about the surgery, but it's also that thing now of I just had surgery a year ago. I don't want to do it again. So I'm holding off and kind of just seeing how things go.
Right. Yeah. I think being monitored is a great way to go. And sounds like you have a good team watching over you.
Yeah. Yeah. Well, I mean, part of it was, frankly, I was pretty vocal after I was diagnosed about, I had a lot of anger initially because I felt like my mom got kind of screwed because she probably should have been getting screened more often. And by the time we caught it, it couldn't be cured. I am very lucky that I got caught extremely early, but I kind of went into it feeling like I was told that they told me it was probably a red herring, and then it definitely wasn't. So again, I can understand from their end why you don't want to tell someone to just get their stomach removed if you don't feel like you have a really good reason. But I was really frustrated and angry. So I think with some of the other screening and treatment, I went in there very proactively being like, I want to take this really seriously. I want to do everything more than by the book. So I'm trying to be very on top of it.
Right. And that's what we've learned also, is that you need to be your own advocate. And when people push back at you, you say, no, I want to do this. Something's telling me, I've got a gut instinct, something. You have to just speak for yourself and be on top of it. Yeah.
Absolutely.
You did, and you are, which is great.
Yeah. I mean, part of it was I learned from watching my mom go through a lot of that. And part of it is, I did work at a hospital, worked with doctors. Like, you see behind the curtain a little bit and see that ultimately they're people and mistakes happen, and doctors and medical staff care about their patients, but they have a lot of patients to care about. And so if you strongly feel like the advice you're getting is not working for you, like you're the only one who's gonna push back on it,
Right. Yeah.
So
gut instinct and speak up.
Yeah. So it's done me well.
So
And then now, just since you're the registered dietitian, if we could get a bit of advice from you as far as
Sure.
the post-gastrectomy diet goes, we've been told that protein is a huge and important vital nutrient that we need to have in our diet, larger than pre-gastrectomy. And is that just because it's helped slow the digestion process, or can you speak toward that? What is the reasoning behind why we need so much protein?
Yeah. Well, especially initially, it's mostly for post-surgical healing. So they cut out the stomach and it's called an anastomosis. So they're attaching, two areas of the body, in this case, the esophagus and the small bowel. And, if you get that Roux-en-Y, like I did, they're moving things around. All of those connections and all of the incisions on the skin are basically made of protein. And so your body really needs that extra protein in order to heal all that. Your immune system kind of ultimately runs off of protein as well. So if you become really deficient, it's hard for wounds to heal. If you get an infection, it makes that harder to heal. And also, especially post-gastrectomy, and I know you have sort of struggled a little bit with keeping up the vegan diet that you had been doing beforehand. I had been a pescatarian for 11 years, and I did drop it for a while. It's really hard to get enough protein when you're also not eating a ton. So most Americans, most people don't usually have to worry about getting enough protein, but here you do become a little bit limited, and it becomes easy to post-surgery rely on non-protein foods. I'm going to have some broth. I'm going to have, a few bites of like crackers or white pasta, or I'm just going to drink fluids. That's what I ended up doing. And I had to force myself, like chicken was one of the only things that went down. And so I kind of just went with it. But I think that's why the protein gets pushed so hard. It really is kind of the building block.
Sense. I did not know that. I thought it just helped slow digestion, but that kind of clears that up for me, is why it's so important. Interesting. And because you were kind of struggled getting that protein in the beginning, did you notice any hair loss?
I luckily I didn't have any hair loss, but I noticed, like on my body, my butt melted, and part of that was that I spent a lot of time really not moving, and like at the hospital they had me get up and like walk around, but for a while that was really all I was doing, and so like I did see a lot of my muscle really sort of go. Yeah. So, but I know some people, yeah.
Have you gotten your butt back? Have you built your muscle back?
It's still not even all the way there. So I don't know. I need to start like lifting weights or something. It takes a really long time. It's especially when you have, your post-surgery, you have inflammation, that protein and like that muscle loss happens really quick, but it takes way longer to rebuild it than it takes for it to come off in the first place. So, it's been slow going, but luckily, getting there.
How much weight did you lose?
So, if it's okay, I'm going to use numbers just because like of my pounds. So when I was diagnosed, I was around 135. I gained up to 145. That's as much as I could like push it eating, as much as I could.
That's really good,
I'm really happy with that. I really went crazy, and then I hit a wall, and like I would just have to stop.
Yeah.
But in that first 6 weeks, I lost about 20 pounds. So luckily I gained that weight because I was about 10 pounds down from where I had started at. And it took me at least 6 months just to gain like 5-6 pounds. And I'm still not 100%. My average now is around 130. And I'm very happy with that. And I think that's kind of my new baseline. I didn't really know where it was going to land.
Yeah, 5 pounds less
you're just
than
5
you started.
pounds less.
That's really good. That's really
Yeah,
good.
but it took 6 to 9 months to just get back to that point. But I am very happy with it because I know some people really struggle with the eating and with sort of staying underweight, and it can be very hard to push it. So I'm lucky that I was able to kind of bounce back.
Right. I want to ask one more question since you are a dietitian, and I don't mean to put you on the spot if you don't feel comfortable answering. I kind of just want to clarify a little bit about the dumping and the sugar. Why does that happen? I mean, because they say the stomach is just the holding tank. So why are we affected so differently with sugar without a stomach? What is it that the pancreas is doing? Like, why is that happening? Do you know why?
I
I'd love to
do.
know why.
Yeah. So dumping specifically happens with simple sugars, which is why you might be able to eat, and at least I found this. I can eat like a slice of cake or a cookie, but like juice and some of these really sugary drinks are tough. So what happens is normally when you have a stomach, if you drink something like juice or soda, it lets out that simple sugar into your small bowel slowly. Simple sugars like that draw in water. It's like an osmotic, it's trying to like dilute it. So
Okay.
when the sugar hits the small bowel, water goes in and it, eventually mixes and forms stool. But that takes a long time, especially if you're eating things like fiber and fat, slow things down. If you don't have a stomach, all of the sugar that you just ate or drank, instead of it getting released slowly into the small bowel over a few hours, it dumps. It all goes in right away. And
Oh.
your body's like, we need to dilute 12 ounces of the sugary drink. You get a huge rush of water into the gut, and there's only one way for it to go, and that's out. And so that's why some people get like watery diarrhea, but it can also, I get early dumping if I'm not careful, and all of that diluting, it's kind of pulling from the bloodstream, and that's why your blood pressure can really drop. So I get dizzy, I get lightheaded, I get really sweaty,
Yeah.
and I have to kind of like lie down. Luckily, it doesn't happen too often anymore. Again, because I'm more careful. But yeah, so that's kind of what's happening.
That makes the most sense. That's the most clearest I've ever heard. So that's the dumping. It's
Yeah.
dumping into your small intestines, and then you have the effects of it.
Right.
So it's not your pancreas with the insulin or anything like that. It's just the water pulling.
So with the pancreas and all of that, some people get late dumping. And again, because it's sugar, the pancreas is the part of your body that secretes insulin, which takes the sugar from your bloodstream once it gets there and pulls it into the cells. So sometimes your body can have messed up processing if you get hit with all that sugar right away. There's a huge release of insulin, and then all the sugar gets pulled into your cells really quickly, and so your blood sugar can spike. So that's kind of the late dumping. So there's a lot that goes on with this, and the stomach is important. So
Right.
That's
So
the
the
most
dumping
well
into the
explained.
small intestines and the dumping of the insulin and the late dumping. Oh, that makes it so much more sense to me.
It does.
Yeah.
I wonder why. I mean, I really haven't tried any sugar yet, but I'm able to drink like natural fruit juices, like just not processed sugars, just the natural without any problem. Do you find yourself to be that way too? Like if you have a fresh pressed orange juice, I mean, what's the difference in these sugars?
There's not so it depends on kind of like the full mix. I tend to dilute if I have juice because I do have a hard time even with the fresh pressed. Some of it's also speed. So I also just personally, like a few months after my surgery, I decided to treat myself with a fresh pressed juice, and I knew it was probably going to be a bad idea, but I also drank it in about 15 minutes. So I think if I had sipped it over an hour or two, it would have been fine, but I really just did it all at once. So with all of this diet after the gastrectomy, so much of it is about speed and portions. Like there's lots of foods and drinks that I can have if I limit the portion size and I make sure to chew well and spread it out versus if you do it all at once, bad.
And you're going to have that dumping and the pulling of the liquid. Oh, it
Yeah.
all makes so much sense.
Yeah, but that's
Thank
great
you for
you can
that.
do juices already. I'm just looking at your Instagram. I can't believe the things that you're eating and tolerating. Like that's amazing.
I know, I can't either. I keep saying, like, did he really take my stomach? Because I really feel normal. It's weird.
Yeah,
Every
that's
time
amazing.
I kind of get a little scared, and I'm scared to try the sugar because of all everybody's stories. It's like kind of a little bit PTSD, even though it hasn't happened to me yet.
Yeah.
PTSD.
I think it's about
everybody's
portion.
stories. Yeah.
Yeah.
For sure.
We all have some kind of PTSD from that one thing you ate, and then afterwards you're like, oh, that was really bad mistake. Mine is this juice that I tried, so I am a little bit wary with juices just because I was nauseous for about an hour afterwards, but nothing was going anywhere, so I just had to like ride it out. I like took a Zofran and laid on the floor, and so I'm like turned off by juices now for a bit, but
Oh,
oops.
It's funny how our brain does that to us. It's protecting us.
Yeah. Yeah.
Oh, wow.
no.
Wow. Well, amazing.
I know. So, okay. So have you met anybody yet that has had their stomach out in person?
No, I haven't. Yeah,
We know people in New York, don't we?
Yeah, we do. We know Jessica.
Jessica and yeah, I guess.
I think there's a couple more people, but I can't think of their names right off the bat. Because
I'm
Jessica went to
sure
Southern
there
What
are.
about Stacy? Doesn't Stacy live in New York? Seahorse Snacks?
I don't know, but it would be so fun to
I
share a
know.
reunion with all of
I
Wouldn't
know.
That's what looked me up now. I'm like, I'm new to the community, so I don't. But yeah, I haven't met anyone in person, but it's been nice to see people on socials, and again, it just that sense of isolation of, you know, I mean, I've been very vocal about it, which I think has been really helpful. I told all my coworkers, my friends know. I'm back to dating and trying to figure out like when to talk about that. Just with the new person in general is like a weird conversation because people's reaction is usually like, oh.
Yeah.
That's where like people just don't know what to say. So
Yeah.
it is nice to talk to people where you don't have to explain.
Right.
Yes,
Just
Absolutely.
yeah.
Now, so you're back at work at the hospital, right?
so I was, and then I actually took another job. So yesterday was my last day there. I like
Oh my gosh.
quit and for a lot of reasons.
Now,
And
what
what
are
are
you
you
doing? What are
now?
you doing now?
So I actually took a position. It's going to be outpatient through a hospital. It's telehealth and it's GI medicine counseling.
Oh,
So
that's
like,
awesome.
yeah, I'm really excited. So like people with like IBS and like bloating and digestive issues and walking them through
That's
the diet
perfect.
changes. Yeah.
You
Yeah.
can speak to that. Now, before you left this job, did you have any gastrectomy patients that you were able to like relate with that had their stomachs out?
So I've had a few partial gastrectomies in the past. I had never heard of this CDH1 gene before it was in my family. The hospital I was at just doesn't happen to have a huge like cancer genetics program. And I think part of the scary part into going into surgery was I had seen a few gastrectomies and I've seen the worst. You know, I saw someone who had to have like an emergency gastrectomy and lost a ton of weight and struggled and ended up on IV nutrition. And like, it was good going in as a dietitian, knowing some of what to expect with the diet, but it was also bad in that it's hard not to focus on the worst case scenario. So
Right.
Like, oh gosh, that's gonna happen to me. Oh,
I know.
yeah.
I think that's why a lot of people are hesitant to do it. Like I am. We've interviewed so many people, and that's exactly right. I focus on the negative outcomes.
Yeah.
I'm like, I don't really want to do it right now.
Yeah. And that's totally understandable. I think we're coming from different perspectives too, where, I was not going to sort of wait and see and screen because I had two family members who had died from it. And so I was already petrified and I was like, fine, I don't want to have this surgery, but I didn't even sort of consider it an option. And that option was never offered to me.
Right.
But like, of course you'd want to sort of wait as long as humanly possible. But that being said, I from what I understand, the outcomes are really good. Like if you're going to a surgeon who has seen this and knows what they're doing, like people get back to their normal lives, which is amazing.
I agree.
I think
even if there are a few hiccups in the beginning, like you did, and I had one, a lot of people have some hiccups in the beginning, but then they make it, then they're fine.
But I do think that's very important, and that's what we've said from the beginning, is it's so important to go to a center of excellence, to a doctor who has had experience, who knows what they're doing. And just because it's just, I feel like
They need to know about CDH1 too, specifically.
Right. For the
Yeah.
dietary restrictions and the phases and everything, the
Just
healing.
making sure that they've got all those signet cells out.
Yeah.
Absolutely. Yeah. Yeah. No, they told me clean margins, and I think I remember when my mom was initially diagnosed, we met with actually the same surgeon who I ended up using years later, but we sort of had the conversation of, well, can't we just cut the tumor out? And they were like, that's not how it works, and sort of reading up on it and how aggressive it can be. Like, I was glad that I was with doctors who really were going to sort of shoot straight and really sort of take the time to explain, like, this is what we're looking at. Here's your options.
Yeah, good. Well, it's been a year, and you look healthy, and you look amazing, and congratulations.
You.
And we're
Thank you
sisters
so
now.
much. Yes.
You're my sister. and I'm your
Seahorse.
sister.
Yeah, and congratulations, not congratulations, but I mean, it's amazing how like well you're doing, and it just seems like you feel well, like living your life. Like, that's just incredible.
Yeah, thank you. And back to you as well. You're doing great.
Yeah.
Starting a new job. Good luck with that.
Thank you. I'm excited. I got a full week and a half off, so I'm relaxing.
Woo! That
Oh,
sounds
good.
amazing.
Well, you gave us so much wisdom. Do you have any additional advice that you'd like to leave us with today?
I mean, I feel like the community stuff, like, get on Instagram, get on the hashtags, talk to people. Like, I never would have met you guys if I hadn't sort of like dug around. And I do think seeing that you're not the only person going through this is really helpful during those times where you're like, this feels like it is just never going to end. And you can look and be like, it does. And people, get back to yoga and running marathons and having babies. And, it becomes just this thing that happened in the past. So.
Right.
Exactly. Yeah.
Good. Well, we're glad that we're here, and we're glad we started this channel, and
Yeah,
it feels really
definitely.
It was so nice meeting you.
Yeah.
It was really nice to meet you
In
too.
person.
Yes.
Everybody talks about it. We just need to do it. We need to
We
make
do.
something and
We do.
a meetup.
Yeah.
Yeah.
Really-
There needs to be like an Excel spreadsheet, a Google Doc. I'm sure that's like the whole process.
Yeah. Anybody out there want to volunteer to set something up?
Yeah.
All right. Well, thank you so much, Ilana.
Yeah.
It was
Thank you.
so nice talking to you. It was great.
Thank you so much. You too.
All right.
Have a
Bye.
good one. Bye.
Bye.